and Joy on the set, the Super Morning Show is always the best on Joy 99.7 FM.
There you go.
I have the joy. I don't see the coffee.
All right, let's start with the update on COVID-19, Wednesday.
Exactly. So talking about the updates, in Ghana now we have 641 confirmed cases. 8 of them have died. 83 have recovered, and so what it means is that active cases are 550 in Ghana. 83 have recovered. That's the good news, Daniel.
Yeah, it sounds really good. I read a bit further. It says 17 have been treated, reverted to negative on repeat test, and discharged. 66 have tested negative once and are awaiting a second test. This brings together a total of 83 cases that have been recovered or discharged. So they haven't had a second test. Anyway, Dr. Kaba will join us today for us to get into those details.
If you check the Ghana Health Service website on COVID-19, so when they say that 83 have recovered, what it means is that they've had a second, because the last time they actually updated us, they told us that they were waiting for their second result, and once they put it there, recovered, it means the second one is also tested negative.
Right. I just read from the GHS website though.
Good stuff there.
So 66 have tested negative ones. That's the updates right under the picture. Anyway, let's
okay. So let me, on a lighter note, bring you some COVID stories from the African continent. Well, there's a man who's been arrested for selling essential services permits in South Africa. And so a Zimbabwean national has been arrested in South Africa because he is producing essential service permits in his house and selling them to people so that they can move around. So some undercover officers contacted him because they wanted a permit. And guess how much he's selling them for? $16 or £12. So for £12, you can buy your freedom in this lockdown in South Africa. That's what's happening in South Africa. In Kenya, the governor of Kenya's capital, Nairobi, has sparked controversy. So what he did was that he announced that as part of the food pack distribution that he was putting together for poor families, he was also going to add a small bottle of Hennessy in the food pack that he will be given to people. He quotes the World Health Organization wrongly by saying that it has been revealed that alcohol plays a very major role in killing the coronavirus or any sort of virus. And the local station, Citizen TV, tweeted the footage of the governor making those remarks. Kenyans apparently are very upset with him. One, it's his spreading false information, encouraging people to drink. And we know that we've been talking about alcohol and the fact that it actually decreases your immunity as opposed to increasing. Well, the Kenyan governor is putting a bottle of Hennessy in food packs for people. Hopefully that will be checked. Other news, DR Congo have considered extending the confinement zone. They are on lockdown, Kinshasa, but they're considering that they might also just move it further out of town. And Malawi has declared a 21-day coronavirus lockdown to curb the spread of the virus. They have confirmed a total of 16 cases, including 2 deaths, and the lockdown will commence on April 18th. So with a very low number of cases, 16, they are going on lockdown, which I think it's a pretty good way to start, because like we know, if we don't move, the virus doesn't move.
Exactly.
So this is what's happening around Africa in terms of COVID-19.
Well, I think the Kenyan governor certainly needs a lot of education. That governor needs a lot of education. But the Malawian situation, they're supposed to go back to the polls. And it's also a nice way of ensuring that you don't go to the polls.
So there's a lockdown. We can't have elections.
Yeah, there's a lockdown. The elections were cancelled, because of a lot of malpractices. So they're supposed to go back to the polls. And government is saying, we need to, take precautions. We need to ensure that you're safe. Prevention is always better than cure.
So whilst we are applauding them for the fact that it looks like they may be taking the necessary precautions, actually politically motivated. And talking about political motivation, there's been a lot of that political motivation coming up in a lot of conversations, which we will not be going into, but rather be going into the safe space of headlines, right?
Exactly, anymore. So the Ghanaian Times for this morning says, Tor MD resigns over bribery scandal. Public warning, coronavirus is real. Follow prevention protocols to stop COVID-19 spread. And COVID-19 National Trust Fund receives 3.2 million Ghana cedis, 250,000 donations. And still on COVID-19, 143 casual workers laid off at Tamale Hospital. Backpage says Family Health Hospital presents PPEs to Greater Accra Regional Hospital.
All right, on the back page of the Daily Graphic, Winston, the AMA has launched their Wear Your Nose Mask campaign, and that's to encourage people to wear nose masks. Now, the World Health Organization a few days ago put out some information about the importance of wearing nose masks. So apparently, it's not good enough that if, for example, I have the virus, I'm just wearing it. You who don't have the virus need to be wearing it. It's not good enough that you who doesn't have the virus is wearing it. I who have the virus must be wearing it. And it's much more effective if everybody is wearing it, because we're sort of keeping our I don't want to call it disease to ourselves, but we're pretty much, sort of keeping ourselves to ourselves. So wear your nose mask, get one. Tamale Central Hospital lays off 143 casual workers. Disregard video on reopening of schools. That's according to Director General Professor Kwesi Opoku Amankwa. We can't fight COVID-19 in fear. Dr. Letitia Apia. Zenith Bank supports COVID-19 fund with 1 million Ghana cedis, and I'm tempted to sing Zenith Bank in your best interest. Couldn't resist that one. Blood banks run dry. Dr. Justina Ansa, and that's it for the Daily Graphic.
And the new Crusading Guide says Tor boss resigns over $4.5 million bribery allegations. Bloody clash at Kokro beating chief elders of Namwalong petitioned government over Shanzi's agreement. And the back page says we can't afford total lockdown. Majority leader asserts, and Cocoa Board confident of annual syndication despite COVID-19.
MyJoyOnline.com says coronavirus recoveries in Ghana leap from 17 to 83. Ghana's coronavirus case count rises by 5 to hit 641. And a sad one here, pregnant Ghanaian nurse dies after contracting coronavirus in the UK. But at least the baby survived. CityNewsroom.com says use old register for 2020 polls if coronavirus challenges linger. Codeo advises EC. Coronavirus has exposed Ghana's fundamental problems. Akoto Ampao says the number of recovered persons increased to 83. StarFM.com.gh also has that story of COVID-19 cases rising to 641. Tor MD Asante Beko resigns over $2.5 million bribe. Now, the BBC.com has that story that you were telling us about earlier of Malawi declaring a lockdown. Kenyans attempt to storm out of quarantine center. That's also here. It has a Ghana story here. Ghana mortuaries congested as people avoid private burials.
Yeah.
Yes, Henry Kwesi Bedu actually went out to visit some mortuaries yesterday, and it was quite the picture over there. Now, it also says that Tanzania's cases jumped significantly. South Africa reports 7 new coronavirus deaths. Kenya's attempt to storm out of virus quarantine center. And Thursday's wise words are: a spider's cobweb isn't only its sleeping place, but also its food trap. Let's get into the details.
All right, so let's start with the new Crusading Guide. And the back page says we can't afford total lockdown. That's according to the majority leader. So, some Ghanaians anymore have been calling on government to go for a total lockdown because, the partial lockdown isn't working. Well, according to the majority leader of parliament and member of parliament for Swami, Osechi Mensabonsu, the government is already spending a lot of money during this, partial lockdown of only Accra and Kumasi. And so government can certainly not go into a total lockdown. What that would mean is a lot more people wouldn't be working, and so government would have to take care of all of these people. And so government just can't do that. And, talking about lockdowns, partial lockdowns and whatever, the World Bank was talking about how Africa had to think of its own version of a lockdown. And so yesterday on Upfront, for instance, we discussed towards a lockdown that works for Africa. And Dr. Nimoy Thompson, said we should be easing the lockdown within Ghana. And so for, some persons within the informal sector, they should be giving a chance to work. Say, the barbers, the, hairdressers and other people, the mechanics, you could actually be giving a chance to work. But these ones should be discussed with them in such a way that they adhere to safety protocols. And that is very, very important. That's where, if you go to Nigeria, for instance, you have markets opening every 48 hours from 10 to 2 p.m. They run shifts and they ensure that the safety protocols are adhered to. Maybe it's about time we tried that in Ghana.
Yeah, interesting one there. When we talked about this morning, I was kind of on the other side of this because I leaned more towards the total lockdown. I think a lot of that really, Winston, stems from a place of fear, of seeing how exponentially the numbers could grow. If you look at Italy, if you look at South Africa, Spain, the UK, the US, and how ultimately it's been the forcing of people to stay home that has sort of flattened the curve of the disease. So I hear you, and I feel the pain of people who perhaps don't have jobs like us. We can still come to work and we can still earn, but like you said, the hairdresser, the barber, people who need that. But how do we as Ghanaians really find that balance? Because we are stubborn. There are still people on the streets. Yesterday I came out of my house and I was going to take something from the car, and I could see people, standing outside. I was driving to get some medicines from the pharmacy, and there were some people by the roadside, happily chewing bankun, with people surrounding them and, having a chat and chewing sticks, And so I wonder, even with us saying that we're on lockdown, there's still so many people who are just very lax about it. So do you then blame the education that has gone out or hasn't gone out? Or do you think that if people are educated well enough, then when we ease up on the lockdown, we will be able to control the spread?
So, finally on this bit anymore, in Liberia in 2014, when they had Ebola, government imposed a lockdown in one of the regions. It didn't work. What did the government do? Government immediately went to the area and advised the local council to actually come out with a system that works for them. You can see that on Tuesday, the Ministry of Chieftaincy and Religious Affairs came in and said we're going to use the chiefs and all of that. A lot of people don't understand the things we're telling them. Things must be tailored to meet societal challenges and needs. If you don't do that and you say wholesale, partial lockdown, my sister, the man sitting somewhere doesn't understand the partial lockdown you're talking about. Somebody needs to explain it to him. If he understands, the situation we're dealing with, how many people haven't said that the disease is a rich man's disease? Because they don't, the virus affects only rich people.
Or white men.
They don't understand. If they did, they wouldn't be talking like that. So let's help them to understand in ways that they can understand and not ways that we think they should understand.
Good point there. Something else that we need to understand is we need to give more blood because our blood banks are running dry. So Dr. Justine Ansah has been speaking, and she has said that the service is sending out a distress call to members of the public and organizations to voluntarily donate blood to blood banks in the regions to give a lifeline to people who need it. She's the Chief Executive Officer of the NBS. So she's saying that a lot of people have stopped giving because of the lockdown. So people are actually not coming to the hospital. People are being very conservative, and there is a shortage at the moment. And so if there's any emergencies, accidents, or anything any situation that requires blood, there is a bit of a problem with that. So but the thing is, and the question is, within the parameters of being locked down, do you go to the hospital and give blood? How would that work? So perhaps maybe a conversation with her at some point, just to educate the public on how we can actually give in these times might help.
We're still on issues relating to COVID-19 because the world has been reacting to Donald Trump. We know now that Donald Trump, as the U.S. president, has instructed his administration to temporarily halt funding to the World Health Organization over its handling of the COVID-19 pandemic. According to Trump, the World Health Organization failed in its basic duty and it must be held accountable. He says that, it promoted China's disinformation about the virus that likely led to a wider outbreak. So that's Trump for you.
So speaking of greater good, then if they withhold, who suffers? And apparently, Daniel, you were saying they give about 15% of the budget for the World Health Organization, right? Okay.
Yes, they do.
Okay, all right. Well, Tamale Central Hospital has laid off some of its casual workers. The workers include cleaners, records assistants, security personnel, assistant laboratory technicians, ward assistants, and clerks. Apparently, because of COVID-19, a lot of people are very reluctant to come into the hospital, and so the services of these people are not needed as much. Now, these workers have been speaking, and they're saying that some of their salary is actually owed them since December. The management of the hospital is saying that they have not laid them off. It is a temporary situation until things get back to normal. But then it also brings us back to the point that you were making, Winston, about the fact that, the lockdown will affect people in adverse ways. So there's 140 people from the Tamale Central Hospital who are currently at home on no salary, no work.
Exactly, because like they say, the vulnerable would take the lottery of infection than the certainty of starvation. They would prefer to gamble than to be assured
of
the
certainty of being hungry. Yeah,
exactly. So they certainly would do that. But some bit of political news, because many of us have been talking about whether or not election 2020 would even happen or not. And so there's this piece by Professor Ransford Jampo, and he's talking about the need for broader consensus on the postponement of 2020 elections. And he's talked about how in Ghana, you know that the presidential elections must not take place earlier than 4 months, nor later than a month before the term of the president expires. And the term of the president expires on the midnight of 6th December, 6th January. So come what may, on the 6th of January, by 12 midnight, as we get into
7th January,
the tenure of President Akufo-Addo would expire. And then Parliament also would have their tenure expiring at the end of their last session. That is normally on the 6th of January or whatever. And so he's asking the simple question, how do we handle it if the pandemic extends beyond this time? And he says that we should have a consensus. We should be building consensus. Political parties should be having a discussion on it and decide how to go. He says that, well, the Chief Justice doesn't come in here at all, even though we say that in the hierarchical arrangement is the President, Vice President, and the Speaker of Parliament. The Constitution of Ghana doesn't anticipate that the Speaker wouldn't be around for us to swear in the Chief Justice. That's something we should consider and find out whether or not it's important to postpone elections.
So on this, I just want to take you quickly back to that WHO US story, because the 2018-2019 budget of the WHO was 15% of it was funded by the US. That was 400 million. But the latest figures from Bloomberg is that it's actually gone up to 22% for the 2020-2021 dues.
Okay.
So the most updated one is that the US is programmed to give 22%
of the total budget.
Yes, but the 15%
was
from 2018 to 2019. That's 400 million.
I wonder what that actually then will mean for the WHO, especially in terms of fighting COVID-19, if the US is going to not give this 22%, which they were set to give. Yeah,
well, Dr. Gabriel, who's the head of the WHO, mentioned that they'll make sure that they make up for this gap in funding that the US was supposed to provide. But the online news review was brought to you by Zenith Bank in your best interest. Goyle Good Energy. Now cover your mouth with tissue when you cough and dispose of the tissue immediately. Wash your hands with soap and running water, which have been provided at all our service stations, especially when you handle money. You can also use an alcohol-based sanitizer. If you are not in a position to wash your hands, maintain a minimum distance of 1.5 meters with other customers and or attendants. Let's observe these simple protocols and together defeat the COVID-19 virus. If you exhibit any symptoms, do not head to the hospital immediately. Call the hotlines and ask for help on COVID-19 hotlines 055-2222-004 or 055-2222-005. Banking from home just got exciting. Here's how. Zenith Bank has waived charges on its electronic banking platforms to support you reduce your use of physical cash during these challenging times of COVID-19. Enjoy free transfer of funds and free payment from your Zenith accounts to any bank account via ACH and GIPS Instant Pay GIP. Bank from the safety of your home. Stay safe with Zenith Bank's digital banking products. Zenith Bank, in your best interest. You're live on the Super Morning Show. We'll be back.
*442# is the new mobile banking formation in town.